At 6:30. Let's call the meeting, the July meeting of Health and Human Services to order. Roll call, please.
Dale Schlever,
Yeah.
Marshall Savitsky,
Here.
Jesse Better,
Here.
Michael Maestri, he's going to be absent, Chris Rusk, Lorraine Gouget, Don Pettit. Don is here online, we see. Carol Pearson. Yes. Sabrina Dunlap.
Present.
Yes, Sabrina's here. You have a quorum.
Okay, stand for the pledge of allegiance.
The United States of America. Republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Certification of compliance with open meeting laws.
This meeting has been noticed to the public and news media as required by section 19.84 of the Wisconsin statutes.
Thank you. Meeting agenda, any changes? Okay, we'll move on to public comment. Public. Have one? Okay. Consider approval of minutes from the previous meeting.
Second.
First and second. Discussion. Everybody in favor, say aye.
Aye.
Anybody opposed? Motion passed. I didn't miss anything here, did I?
Nope.
Committee reports.
LCO, I got an email from Lorraine.
Okay,
She's asked me to read it. It said, "Good morning all. Yesterday we had 10 positive cases, COVID, which leaves us with 20 active cases that we know of. We are now really approaching another serious stage in the community with the upcoming Honor of the Year powwow. Please remember to socially distance when possible. Wash your hands and mask if at all possible, even outdoors. This Omicron B5 variant has a much shorter incubation period and requires a lower viral load, making it by far the most contagious yet. Fortunately, if you have any immunity, most people will not get seriously ill. However, even those at high risk, like elders, can get very ill with this. The entire county is at high transmission levels. Please be safe. Stephen Miskowitz, MD."
any comments? Nothing from the Senior Resource Center this month. Admin,
On admin, I just have the list of our services, and I think we'll have this being a standing document so that if somebody presents from a unit, you can have something to reference to. So for tonight, it's the Children and Family Services Unit, which is Child Protective Services and Youth Justice. So when Carla McKay, the supervisor, goes through, you can kind of follow along what she's covering.
so what's going to happen?
I'm gonna have this under administration each month, because I just, unless everybody's gonna bring this list with them, I don't think you're probably gonna do that. So I'll have it on here. So you can reference it if somebody's talking about their unit, giving a unit report, and you wanna remember what the services are, because there's a lot to remember. And so like for tonight, when Carla presents, you can follow along when she's talking about these services. That's all it's.
What's next here?
The adult long-term care, we're recruiting for the new supervisor. We haven't had any applicants yet. I've been working with the unit. We're having regular meetings and talking about how we're going to triage it until we get a new leader. They're doing okay so far. I took a couple of the workers, we had to order some furniture, and I took a couple of the workers, so 3 of them, over to the new building that's getting remodeled, and so we can count chairs, make sure we get the right amount of stuff, and it went pretty well. They were happy with how it's progressing, although everybody asked me what the end date is. when it's done, it's done. I don't know. I don't know. And then related to Oasis, I want to make a comment. I'll try to keep it relatively short. Because there seems to be some confusion. Last month at the Public Works Committee, somebody within our department told me I might want to watch that, so I watched it. And there was a conversation about Oasis, and the discussion went, well, how did Health and Human Services, how could they get to go to Oasis? And then somebody said, well, the director asked for it, and the long-term care supervisor asked for it. And then one of the county board supervisors, oh, the director has to do, actually before that, they asked, how come Health and Human Services always gets what they ask for? So then it went to this discussion, well, the director, evidently I have a lot more powers than I know that I have. And so they said I requested it, and then they were talking about how absurd that is. And then I think virtually the whole room laughed, and it was kind of taken aback by it. Bothered by it, but not overwhelmed by it. What concerns me is there was nobody in that room could give any history about how we got to Oasis to go over there. As if somehow I raised the magic wand and the board just said, oh yeah, the director asked it, they're going over there. So I want to briefly just review how we got there. The tenants in there, the group home, left on September 30th of 2021. I think it was actually the following day, Tom Hoff, the previous county administrator, Tim Hagbird, our maintenance supervisor, myself went over to see how the building looks. And we're walking through it, and Tom says, what are we going to do with this? And I just popped in my head, this would be great for the ADRC, for everything I ever heard about it for space. And Tom goes, yeah, that might be a good idea. And then it sat for quite a while. I didn't know Tom said, I don't know what happened with it. But then finally, I think when Tom announced his retirement, he goes, let's revisit this. Where is it at? And I said, I've been waiting to see what you want to do about this, Tom. He goes, I think we should move forward with this. So he said, well, let's bring it up at the January board meeting, which was January 11th. I said, you want me to bring it up or you want to bring it up? Because you can start it and then I'll chime in. So we talked about it that evening, and it seemed we got a pretty good response from our board. One county board supervisor said, well, how come Health and Human Services get it? Maybe somebody, other department wants it, maybe Veteran Services. So, okay. So after that board meeting, I don't know the exact date, but myself and Lori Perlich, the previous adult long-term care supervisor, and Gary Elliott of Veteran Services met over there to talk about the space, because he needed, first of all, it's too big of a space for that department to be in there. They don't need that much. But Lori said, well, maybe we could cohabitate in there. So we went over there, discussed it. I won't go into all the details. I don't know that it was going to be a perfect fit because we're going to be short in office, and I didn't know about storage between both departments. But anyway, it moved forward. They moved him over here. One of the things moved him over there, and I talked to Tom, I go, this will probably work till the end of the year, but then there was an alternative plan, which I don't know that's going to happen, but that's neither here nor there. But then on February 8th, we came back and we talked about it. I reviewed that we talked to Gary Elliott, and then they were going to move forward with remodeling. Whatever committee it went to after that, I have no idea. I don't know what chain of command went to approve this, but it moved forward. And then I listened to this meeting last month, and I was really taken aback. Like, why would anybody say that? So I don't know who's the historian about keeping track about how the decision was made, but I'll tell you what I won't apologize for. I won't apologize for advocating for services, especially ones were mandated, and I certainly won't apologize for advocating for services for the elder population and those with disabilities. And also, I won't hesitate to advocate for our workers that provide those services. There was nothing there. I said there was nothing where it would prohibit anybody else to say that they want that space. I don't know where it went after our board meeting. I have no idea where it went. A black hole, the abyss. I have no ether. I have no idea. But it moved forward. So that's how we end up. That's how we end up going over to that building.
Any questions?
I have one question. Gary Elliott, does he report to any committee? Which one?
Admin.
Ad-
Statutorily, the veteran service reports to the administrator.
Okay, thanks.
I mean, he reports to the admin committee.
The understanding I had, and I thought it was just fine, and I'm pretty sure everybody was in on it.
Yeah, but I don't
Was
know,
it
I don't know if it
you?
goes to admin, or where it goes to after that.
It's supposed to go to anybody, as far as I know.
I thought
It was passed off that you and Tom,
Lori or Gary,
Gary and I think it's,
Tim.
Tim would figure it out.
Yeah.
And that was it. Good, go ahead, figure it out. But I do want to mention one thing. As long as you have all this power, get your budget request in quick.
Well, I know, that's what I thought. I go, mine, I've been holding back. My God, it's more than I can do. So,
I don't know the history. I know when I started, it was well underway, and that's what we're gonna do. So the timeline, there's quite a bit of lead time on furniture. So I think maintenance, Tim and his crew will have most of the construction wrapped up in the next 30 days, it sounds like. But we're not gonna make any moves until we have all the furniture. In.
right.
We're not gonna move twice, we're gonna wait until we have it ready, and then be looking eager to see at that time.
You know, I have talked to Andy about this, and I don't fault him because he was at this transition period, but it's like, I don't know where all that decision-making went other than this board and how it gets messaged to the full county board. I have no idea. But I just was taken aback about how that conversation was.
Well, the committee that would probably be dealing with this would be Public Works.
Yeah.
So,
So nobody in the room would know, and anyway.
The phase two, I think you're talking about is the other half of the building. The other portion of it is currently leased. There were some questions on that the last couple of months. That lease does expire at the end of the year. So we'll have to decide if we want to re-up. There's phase two, I think, was that there's concerns about having enough space or storage space for veteran services and ADRC at that building. So
Yeah, the plan, and then Tom had said he had talked to some county board supervisors, and it wasn't official that, you know, if the day treatment wasn't in the other side, that veteran services would like take that first third, and that'd have been perfect spot. So that's kind of what I was operating under, but then no fault of Mr. Alvarado, but then that's when the whole transition happened and all those loose ends weren't tied. And then I hear there's other plans for that building or some opioid treatment. I have no idea.
I don't understand, Matt.
I'm sorry.
That building was funded and started the programming in that building how many years ago, Dale? Yeah, that was when Pete Sanders was here. And it's always kind of, I don't want to use the word control. We didn't control it, it belongs to the county. But our programming from human services have always been in that building, and the budgets followed that through this committee. And the funding was also created through human services. So I don't understand where the confusion came either, where, I don't know.
I was stunned when I watched that, and then it was right before our
It's
department
always
head meeting.
been,
It's like, oh
I
my
mean, we
gosh.
did discuss at one time selling it, if we couldn't
Right.
get more programming in there that was human services related. But then we were fortunate enough just to switch things around, and it's working. So I don't understand the distress, because that building has always been managed by human services that come out of our budget. It was funded by this budget, and it's been run by this budget for years. Yeah.
Ms. Bennett, please go ahead.
Good evening. When I was a committee member for the supervisor for the county, I always advocated within HHS that that building would be maintained and retained within HHS, because there was talk of the building, they were trying to sell it. And when Mr. Olson also said on the board, we had this full discussion here with Mr. Hoff, where it would not be, we would not get the space we would need for the money that we have in that building. It would cost us a lot more money to try to find space within Sawyer County. And that was one of the things I feared, was that if we did not maintain it, it was going to go to another department, and HHS is always shorted that we don't have the space, especially with what was going on with the courtroom addition. And this is where I had brought up where we look for outside spaces for some of the departments to go to. And this was the perfect venture for that to happen. So it sounds like there's individuals that want it either for different projects or to put it back up on the real estate block. And I have not listened to that meeting. What meeting was that? Just the previous Public Works?
Yeah, last month.
I will listen to it, and if I have any questions, I will start knocking on some doors.
Mr. Chair, may I just make a comment?
Sure.
I've attended all committee meetings and board meetings for a year and a half. I don't remember coming to any board for approval. I think the decision was at an administrator level, and I think they were just caught by surprise that it was already, the decision had been made. But I don't want hard feelings to start because of that. I don't remember going to any board or committee.
Sometimes I need to be real diplomatic about this because I don't want to offend anybody, but sometimes there are differences of opinion as to where the county administrator's authority is and where the county board's authority is. So, and if some people think that ours going too far one way or the other, that's how rumors get started and things like this turn into a mess. Why don't we just move on, Paul?
I'm fine with that.
If there's anything I can do to help you, let me know.
Behavioral health, you have Alicia D. Carlson's monthly report. Just to make a couple comments. CCS yep, has another challenge. The one North Lakes therapist that was certified and was seeing people, but still had a waiting list, is now leaving North Lakes. So that's pretty much all I want to say about that. And you have the mental health cost by client that Cindy Hannes put together on a monthly basis, so you can kind of track where we're at this time of the year.
Chairman, I got a question real quick. Andy, what is that resolution that we approved and you're proposing to take to Wisconsin counties that might address some of these costs? Just kind of briefly, what is that? How is that going to do that?
That is proposing that the state operate the CSP program more like the CCS program.
No, the other way around. Yeah, you're right. That's right.
Like CCS, they changed that funding a few years ago, where they essentially fund all the costs of the county. That'd be to get them to fund the CSP program similarly. In our case, that would be a big benefit because we have a lot more people on CSP than we have in CCS because they don't have the one, the severity of the case, and the two, we don't have providers for CCS.
I can say at the Wisconsin County Human Services Association board meeting last week, they talked about this, and the white papers are going to be out in the near future regarding,
We got the advanced copy.
You got the advanced copy, okay.
Build the resolution off of that.
All right.
Which you'll be at.
So I'll be there, but so we're proposing this resolution so that they'll look at it and make changes.
Yeah, I
Hopefully
mean,
fund the CSP
I would
program.
expect, the resolution is kind of one of those white flag, you raise it up, wave it around, and get some attention.
Right.
Hopefully it'll get some traction because it is built off of the platforms that County Association, the Wisconsin County Human Services Administration have working out already. So they've already laid some groundwork on this, because we had proposed a couple other things Paul and I talked about. They weren't the things that were already kind of moving in the legislature.
The counties are all united on this,
Yeah.
so hopefully.
along with the county administrators, right?
My thoughts are in there. The only concern I have, and I'll keep talking about this throughout the whole process, because we don't want the state to tell us that we have a maintenance of effort to maintain with our, there's nothing we can do about it, but our costs are way up here. A lot of counties are way down here. We would be inordinately stunned
Yeah.
by that maintenance of effort. So,
Yeah, that's always a problem, man, if they pick now. it wouldn't
We're
be
good.
good.
I'm sorry, go ahead.
Move on to Child Protective Services. We have Carla May Kay. She is the Children and Family Services Unit Supervisor, which comprises Child Protective Services and Youth Justice. She oversees that. I've asked Carla to come tonight, like the other supervisors, and just go over that outline of services and give you a brief, matter of fact, report about what those services are. And then also to go over the 2 reports that she has on a monthly basis, the CPS report, and Youth Justice, just to give you some clarity. Oh, and one comment I want to make is right now, in your a little over 9.5 years, just about, we are fully staffed in that unit, and we got some really good staff. It's a really good staff and culture. There.
Very good staff.
You hung in there.
Good evening. I'm just gonna follow this list down that Paul gave you. And I
Okay.
think when he did send this out, you gave some brochures that I put in there with it.
That was early, yeah, I know.
Yeah. The brochures are just simple brochures for parents in the community to know about what we do. So to talk about this, the late term for access is intake. And that just simply means people will call Child Protective Services and report child abuse or neglect. It's taking a report to the level of what the state standards are. Then the report comes in and it's sent to the supervisor. The supervisor has to decide to screen it in or screen it out. The determination is based on our standards for initial assessment and access, and which are the laws and the standards. And so I determine if it meets that. If it does, I document that it does and assign it to a worker. If it doesn't, it gets screened out and it gets filed away. We document absolutely everything. So then if I screen it in, I assign it for an initial assessment. Lay people call it an investigation, a Child Protective Service investigation. There, they have 60 days to do a report. They go out and assess the family in several different areas. Safety is the cornerstone of what they're looking at to make sure the child's safe. If there's not, there's some options. And if there is, there's options to close the case and move on within the 60 days, which leads us into the next part. At the end of 60 days, they may close the case, or we might do a court involvement. We'll do petitions to the court, and it goes through our DA's office, and our DA will meet with the worker and make sure that the petition is correct. And then we'll go through the whole court process. I do not do the details of the court process, but ultimately what happens there is once you go into court, there's a plea hearing. They admit or deny. If they admit, it'll be assigned to go through a dispositional hearing within 30 days. And if they deny, then we set up a fact finding, which can be a jury trial in Child Protective Services. And then we have a fact finding hearing that can be decided by the judge or the jury. If they find that yes, indeed, they need help, then it goes to dispositional within 30 days. If not, the case is closed. Once we get to dispositional, the worker has to write a report on the family about social history, their safety issues, and then once we're in court, then the judge will look at our report and our recommendations. If he agrees with them, He'll order them all. I have seen judges weed out one or two, but for the most part, all of the order is passed. What that whole process is called in Child Protective Services is the CHIPS process, Children in Need of Protection and Services. And that's all the way from the plea to dispositional, and then we have ongoing service, which is the next thing on the list. And there are standards for our ongoing service as well. How many days we have to get out to see the person, what we need to discuss with the family and the child, and also help them to improve their parenting so that it's safe for the child to go home. Foster care is out-of-home care that it can be with a non-relative. It can be with a relative if they get licensed. And then, and it's paid, a paid service. So foster parents have to go through a lot of training as well. Termination of parental rights. Since I've been here, I bet you, I don't know, 4 to 6 termination of parental rights in our community, in our county. This is can be voluntary or involuntary. Voluntary is honestly, it's after years, 15 out of 22 months of working with the family, and it's just not improving. Their drug issue or their mental health is just not improving, and the child's still unsafe. Or petition the court through our corporation council to do a termination of parental rights. And then they'll go in and admit, yes, we want our rights terminated. Or they can do it, we can do it involuntary, where the parents are saying, there's nothing wrong with me. You don't have a right to take my rights. And so we go in, can have a jury trial for it. And it is quite a process. Usually those trials are 2, sometimes 3 days. And then are oftentimes jury. And they make a decision. Wisconsin's one of the few states that still does jury trials for TPR. And then once we terminate, we send it to the state adoption agency, and then the whole adoption process occurs. There are advantages to doing a voluntary adoption, termination, meaning that if they have another child, we can't automatically terminate. But if we do an involuntary TPR, we could at birth come in and take that child, and if nothing has changed, and proceed with the TPR. I will say that even if that law is on the books, the attorneys won't do that, our corporation counsel, but it's a possibility. Kinship care is when we place children with their relatives, and they will receive a stipend for caring for their children, their relatives, I should say. Family First implementation is a new program that came out fall of 2021. We're still all getting kind of used to what we're going to be doing in that, but the big push is to keep kids in home. The pendulum is starting to go back to let's keep the kids in home. Let's see what we can do first there, get programs in there, and some grants have been put out there for us to help keep families together. If we do place in a residential child caring institution, we want them to be QRTP, which is Quality Residential Treatment Program. And these are special services they need to have in their RCC, such as they will do family therapy. They will make sure that when the child is released, that if the community doesn't have to have family therapy, that they continue it until we can find family therapy in the community. There's special money attached to this, so that meant extra court orders and forms that we need to complete to capture that money. The county doesn't see any of it. It's federal money, and it's given to the state to run these RCCs that are licensed by the state. And if the child's under 10 and in an RCC for longer than 6 months, we have to do a waiver. And the director needs to sign off on it, and then we send it to the state, and that flags the state worker to send it on to the federal government. And the federal government discontinues federal dollars towards that placement for the RCC, for the QRTP components.
That's a question. How about for travel placements?
It goes for them too.
I still have to sign off on it? Okay. One of the reasons they did this, so kids want to get warehouse and RCCs and it
Yeah.
would just go on forever, which we've had concerns
Oh, right.
about. So this is
Yeah.
helping to curtail that.
So if they're over 12 and over 10 and in a placement for 12 months or more, then we would have to do that waiver for them as well, and the director signing off.
I have a question. So is this part of our out of county costs, these RCCs? Or is it federally funded? You started to say that, right?
Yeah.
Or it doesn't come out of our county budget?
No,
Is that true?
that's true, but I have to qualify that. We have to put certain wording in every single court order in order for us to capture state and federal dollars. And we know that, the DA's office knows it, and the judge knows it. So we're all looking for it. We have a good checks and balance system. They've incorporated in the court orders that wording. And then once we put everything in our computer system, which is called SACWIS, this other agency called Maximus reviews, all they do is financial stuff. They look at if we're getting reimbursed from state and federal dollars, and then they look at our court orders so that we can capture as much money as we can. And if we don't have something, they will notify us. We have a couple of options at that, either find it in our paperwork that we have, which often is the case. It's in there, but it's just not where it's supposed to be. And so we point it out. But sometimes, especially when we started this in the late 90s, we would have to go back into court and get that ordered for us to capture the dollars.
Carla, but that still doesn't cover all the costs. That's still our highest cost of placements
Mhm.
on here.
Yes.
It helps offset some of it.
Yeah.
But I just don't want everybody to have the impression that it's getting paid for.
Yeah, we're not
It's
getting
not.
all state.
We get some.
And Maximus just calls us and say, hey, we need this, and we get it to them, and then we get all the dollars we can capture. Guardianship, that's something we do here when we've taken a child into care and 15 out of 22 months pass and there's no movement. We start looking at permanency, and one of our options is guardian and sub-guardianship, which are right about by each other on this list. Guardianship just means parent comes in and they want, we've been working with them and we're not going to get the child back. And we want the provider to be some sort of guardian, but that guardian doesn't qualify for sub-guardianship, which means you get paid to be the guardian. So they will just be a guardianship and often kinship and just get the kinship stipend, but it gives the child permanency. Subsidized guardianship are usually they must be those that are foster parents, and it's no hope of the child going home and we don't want to wait for the parents to get healthier because we've already waited a couple of years. We will do sub-guardianship, and that is a special process in which we set it up where the foster parent will then become reimbursed for that guardianship. ICWA, Indian Child Welfare. This is something in our county that we work with every day, almost every hour of every day. We have several things we must do to make sure we're serving the Indian child. If it's an investigation and it's a Native American child on the tribal land, we will contact ICW. We'll find out who the worker is, and then the county worker and the ICW worker go out to do the investigation together. If it's county and it's a Native American child, we will contact LCO and just let them know, we have this child, we're doing an investigation on it because it's county, we go it on our own. I didn't realize this until recently, but we continue to keep ICW involved even when it's off the reservation. We don't have to do that. We choose to do that because they have a lot of vital information for us. And other counties with tribes in them don't do that necessarily. But I think it's really, the workers have found it invaluable to keep ICW involved in those cases because they know the families.
Is this where the 161 agreement comes in then?
We're working on that again.
Oh, okay.
We were almost done and then, is it Nicole left, the attorney?
Yep.
Out there, and so then we have a new attorney that's out there looking it over. Okay, so. Court intervention, we're in civil court is what the court, type of court we go into for family service, for child protective services. People often get that confused. We get a lot of people coming here because about their custody agreements and stuff. That's family court. We don't do that. And they want us to get involved, and we have to tell them, you need to get your own attorney and take it into family court. Same judge, but it's just a different way we do things. Crisis on call. We're open 24/7, 365. We're mandated to always have someone on call. And for child protective services, they know not to do a complete investigation when they get called after hours. What they will do is make sure the child's safe. And if the child is safe, we'll just work with the officer to ensure safety, and then that's the end of that. For youth justice, our goal is to ensure the safety of the child, the family, and the community. And we work with the officers to ensure all of that. Then one of our grants, it's called Targeted Safe and Stable Families. I think it's a grant that's been around for about 3 years now. This was the push to keep families together versus moving them out. They gave us grant money to purchase services for the family in order to keep the children in home. And as we're getting used to what it can and cannot be used for, it's really becoming a very valuable service that we can offer families. Sometimes it's paying rent or respite or parenting classes or mentor type of relationships. Title IV grants, these came about, the ones with the attorneys came around a couple of years ago, but the foster parent grant, we've done forever. So there's 3 grants under Title IV that we do. One is for the guardian ad litem. When we have a CHIPS case, all kids get GALs, and in some YJ cases, they get GALs. And then a bill is submitted by the attorney, register of probate gets it to me, I sign off on it, we reimburse the clerk of courts for it. The other one that we have is for the attorney for the TPR. That's for our corporation counsel. That's a different grant. He then submits his time when we do TPRs, and we reimburse him for that. And then the third grant out of that is the foster parent training. It's mandated. We train our foster parents. The foundation is provided by the state, but then after that first initial 2 years of them being licensed, every year they have to have 30 hours or 10 hours of training, and we provide that or pay for it. So that's where that grant goes to. Second, the Tier 2 services, respite, we use that for families and foster parents that need a break, and we'll pay for respite for the child to go to another home. Step parent adoptions, I think we've done maybe half a dozen of those in the 7 years I've been here. And that's where, just as I said, the step parent wants to adopt the child. And we do charge $325 for that service. If you go private, it's going to be $700 to $1,000. So county, it's a deal for them. So that's that on Child Protective Services. Then there's youth justice. Youth justice are children 10 years and older that do a crime, or they can also do juveniles in need of protection and services, and those are kids 10 years and older that would do an activity that if they were adult would not be considered a crime, such as they run away from home or they're truant from school. So intake for youth justice is we get a report from law enforcement. This child has done a crime and they're going to be charged with X, Y, and Z. We do an intake. There's certain things at intake we must do that are laid out by the law. And we then interview the child and do what's called an assessment. Right now, we do these assessments and we decide what level of court involvement will they get. We can do a couple of things. We can do counsel and release. We just talk to them about their crime. And if they have a good attitude, we're cooperated with the police and the crime was very, very minor, we make counsel and release. The next level is deferred prosecution agreement, which is an agreement between our office and the child that they will do certain things. They can do that for 6 months and extend it another 6 months if they haven't finished everything. And then there's consent decrees that we can do for up to a year. The DA's office knows about it and the judge does sign off on that, but the child is not adjudicated offender. It's just held. If he doesn't complete it and or he commits another crime, that consent decree will be squashed and it will go to, he will be adjudicated and be on a dispositional. Dispositional is we go right, this child has done so much or the crime was so heinous that the community really was at danger. So we'll go right to disposition, take it into the DA and have him adjudicated a delinquent. Court-ordered supervision comes out of those delinquency orders. We again write a report about the juvenile and do some recommendations. The judge gets it and he decides what's going to be ordered. And then in the end, we carry out that order. Case management is doing a case plan with the family and carrying out the court order to ensure the child's successful on their obligations to the court. We can place out of home. We have a couple of YJ children that are placed out of home. They all the way from foster care to juvenile detention center, which is jail for teenagers. And then Northwest Oasis is on here. That's old. We can't use
Yeah,
that.
we missed that. So the
Yeah.
Northwest Passage is a place we send.
Yeah. Northwest Passage for assessment. Then a new tool the state implemented 2 years ago is YAZI, Youth Assessment and Screening Instrument. We've all been trained on it. It's quite an extensive tool. It's evidence-based. We assess the child, put all the information into this tool that's in the computer. It analyzes it and then it tells us where there's high risk and low risk and medium risk. The research has showed low risk kids we should not be getting too involved in because if we do, they will quickly become medium to high risk kids. So we should concentrate on medium to high risk children. And then it helps us know what areas they need the most work, such as, is it family life that's suffering, that this child has no supervision, so they're out carousing and getting into trouble? Or is it just a general attitude that they're angry at the world and they're being a rebel and doing whatever? Or do they have mental health issues? There's 8 areas we need to assess. So, and then a case plan does come out of the YAZI tool. Then tier 2 services. These are some of the things we can ask the judge to order these kids to do. Restitution, pay for the crime they committed if there's a price tag attached to it. Community services, substance use testing, and electronic monitoring. That's it.
Thank you.
Wow.
And I'm also gonna have you just kind of go over the reports,
Okay, I will do
not the
that.
placement one, that's pretty self-explanatory. Just remember that the RCCs are the most expensive on that placement cost report on your substitute care report.
So the reports that Paul gives you every month from my unit, looks like this for CPS, and then for YJ, it looks like this. I printed the most recent one off for CPS. The neat thing about our computer, one of the neat things about our computer system that we use for Child Protective Services, anytime you put data in there overnight, it updates all the data. So it is up to date. So what you might get June 22nd when I printed it for Paul and what I look at tonight may be different. But the same information's in the same place every time. So if you look at, first of all, the case load overview for our unit, we have 74 open cases, 173 children altogether we're serving, 536 adult counts. 142 of those children are in their home yet, 32 out-of-home placements.
What is the adult count number?
The parents.
How
There
many?
might be grandparents
Okay,
in the
because
home.
like, that's more than, how many parents these kids have? Like,
Mhm.
that's more than two.
When we open a case, we will do mom, dad. Mom and dad might have boyfriends, girlfriends. And then they may have grandparents and our aunts and uncles that are close to the family that we work with. I have opened some cases and case participants have been this long in the computer. And all those adults that support that family are counted.
And that's EWSACLIS driven. It tells you the information you have to put in there, right?
Yeah.
Yeah.
Right. Months open. So we've had 23 cases open. 2 cases open 23 months, 11 cases open 19. And then it just keeps going down. Oh, I'm sorry, I read this wrong. 2 months, 23 cases, 11. So then this next one, we have 19 cases for that. And then the real disturbing part is why I keep looking at this. We have 18 cases that have been open 3 years or more. We don't like to see that. We have a couple of cases. We've been really trying hard to do termination of parental rights or subsidized guardianship. It's an extremely difficult thing to do when parents don't want it. We've met with our court counsel a couple of times and lets us know if we have enough where we can go into court yet, and if we don't, what we need to do. And there's a couple of things we need to do yet on cases. This case traits one in and of itself, it's hard to understand because if I click on the top button where it says in-home and 53, the numbers on the left and right will change. And why they will change is the characteristics for those 53 cases change. And then if I click on the out-of-home care, again, the numbers on the left and right change because the characteristics for that, for the in-home, out-of-home care cases change. And then we have case types of all these cases that are open. There's initial assessment, that's 19 of them. Ongoing 14. Child welfare are service cases. Then a couple of cases that have an initial assessment and youth justice going on at the same time. 10 just pure youth justice, and then child welfare and youth justice 4, and then ongoing and YJ 3. And this one, which I put together for Paul, is a rundown of the July 22 youth justice report. current youth, we have zero, well, this even changed since I turned this in June 22nd. But one youth justice child went in July 7th into out of home care. We do have zero detention holds. We have no longer are responsible for one child in serious juvenile offender program. The state took that over completely. So we have zero on that. We have zero active KPSs, 15 informal supervision cases, and 3 formal cases, meaning that they went through to the DA and to the court judge. We have 3 new referrals, but again, this was turned in a couple of weeks ago. That number has increased now. And new referrals to the DA, 3. Requests to waive into adult court, 0. Requests to serious juvenile offenders, 0. Juveniles in need of protection and services, we have 1 youth. And just something to mention, all of our cases in youth justice, no matter what our decision is, we do send the report to the district attorney. And the district attorney will review it. If he has questions, he contacts our youth justice worker who submitted the report to him. And if he has 20 days to overrule us, and if he does, he can make a petition to go into court. There's a lot of checks and balances in our unit. That's it. Very in-depth.
Thank you, Carla.
You're welcome.
The next report is, and I'll just let you know what's here. Shauna White, our economic support supervisor, submitted her usual report. Stellar as usual. And regarding economic support and public health, after next month, when we go over our budget, then I'll schedule them to come in and go over their programs as well. And then we have the COVID update from Julie.
I don't have anything to say. It's all in there. You want me to come sit by you?
I do, yeah.
6 feet apart now. What would you like to know?
Well, I mean, we heard it, the LCO said that there was 20 cases. Is that
Yeah.
just at LCO or is that?
So we do count that fully in the community into, and I don't count total case counts anymore for the whole county. We are going by what the CDC is giving us on low, medium, high. That comes out once a week on Fridays based on the number of cases we had the week before. We are up to medium. This was a couple weeks ago when this was submitted. For LCO community in general, we are seeing a number of our cases actually being tested and coming through the LCO Health Center, and we just have noticed that over the last weekend. So some things are spreading around in that area.
Doesn't sound like it's like that. They say it's more contagious, right? But less.
Yeah, more, it tends to be more contagious, but we've had much less hospitalizations than we had seen with Delta. So yes, this is much better variant to have.
I gotta be honest, I thought COVID was, I thought it was over, so I was surprised.
Well, compared to what it was in January, it's much better. But syphilis, though, on the other hand, if you'd like to talk about that.
That increasing?
Actually, we have, I shouldn't even laugh because we do have a number of cases. That's not very funny. We have a number of cases of syphilis. We had 22 last year. Our final numbers came out. And we have not had cases in years. So, so yes, it's been identified and is spreading. One of the reasons why it did spread so much is because it's something that it's not typically tested for. It used to be if you fit into this category, you would get tested for syphilis. And so it's kind of really out of the realm of a lot of healthcare. And so we now, our rates are some of the highest in the state. It could be, I didn't go through all of the counties, but I think we might be right up there, #1. Part of that is because we did start to identify it mid-year last year and did increase testing. We have put another health alert out to all the providers that we need to continue to be testing. We are still identifying cases. And gonorrhea is also being identified as well, definitely has gone up. So messaging out on safe sexual practices will be happening and getting yourself tested. So isn't it fun to listen to the public health report? Other than that, I think everything that's in here is self-explanatory, but if you have any questions, let me know.
I do, Julie.
Yeah.
So this rise of STDs, is it in correlation to anything, or are they, any idea what's?
We are, one of the things that we are identifying and looking, but we don't want to only test this population, but IV drug users, it tends to be a little higher risk on that. Part of that is inhibitions are lower when you're using drugs. And then the other thing that happens is they do sell sex for drugs. So exchange, basically sex for drugs. And so that is where the spread can come as well.
Do you have, where is the staff that does the tracking? So you have one individual that is positive. So.
Oh, so we have a couple of nurses. So it's different for depending on the communicable disease. Syphilis is a very complicated communicable disease. So that actually has mainly been done at the state level. Actually, it's a good question for you to ask. And the state is getting overwhelmed and not able to keep up with the disease investigations. Plus, this population is a hard population to get in contact with, to try to identify their contacts to make sure everybody gets tested. What is happening is the state is hiring regional representation for that. I might be talking out of term, but I'll say that one of our LTEs that we hired as a contact tracer is going to be moving over to be our regional rep. So somebody who we work really closely with should be able to help us identify these cases. So
Yeah, the tracking is very important.
yeah, the rest of the communicable diseases that's done by internally. Syphilis is just so complex in the treatment and how it's handled that you do have to have it's kind of got to be your thing. You got to be concentrating on.
Sure.
Is, one final question, is monkeypox an STI?
It's not considered an STI, but it is spread through close skin contact. So it has been spread by having sex with somebody, but not through the intercourse. It's through body to body touching.
I assume I'm immune, so.
Aren't you glad you're on this committee now? Do you have any more questions for me?
He's already managed.
I have a lot of questions.
Well, I remember being told that Eileen did do some demonstrations when she was here on how to put condoms on and everything else. So
I forgot about that.
my predecessor. So I'm not getting into that tonight.
All right.
Fair enough.
Okay.
Okay.
Thank you, Julia.
Very good report.
Ms. Boone,
Yeah, if you have Patty's work should be attached, reports.
Yeah.
And she is online if you have any questions.
No questions. Thank you, Patty. Ready to move,
Andy, you sponsor 17?
Yep.
Okay, right.
So I thought we'd have a little bit longer discussion. I think I can make it pretty brief. So this is on here because board updating the board policies and procedures manual. And in there, it lists the committee back section, it lists the committees. Most of the committees, in fact, half the committees have a breakout where it says this is the composition of the committee, these are the roles and responsibilities. And in our board policies, there's nothing listed for human services. The earlier day, I kind of draft up some thoughts I had. But then I thought, that's probably not necessary because this is one of the committees that actually has a full set of bylaws.
Right.
And so the bylaws actually were updated a couple of years ago, and it has exactly what I think we would just include this or reference this in the board policies because it lays out exactly the 9-member composition, the 5 county board, and who the other 4 are. It identifies the election, the terms, and then there's a section that completely addresses power and duties and the roles of the committee. Or it's actually a board, not a committee. So I guess my recommendation is, unless anybody, and this is something you all received in your reminder a couple of meetings ago. So I don't know if you want to review it and see if there's anything you want to change. I looked through it, I didn't see anything. Needs any updates because it was just a couple of years ago.
Anybody? Questions?
Okay.
Do we have to vote on anything?
I guess you could make a motion just to approve human services bylaws in the board policies document.
I mean, I think we would need to, you can't just put it in there without us, but I think. So I would make that motion to include that. That's stated by the administrator.
Approve this in our policy manual.
Yes.
Second.
That's your question.
No.
Okay. Everybody in favor say aye.
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 Anybody opposed? Motion passed. Future agenda items.
2 things. Next month, we'll go over the 2023 budget, have it presented as usual. And also, we probably should have done it this month. It slipped my mind. We'll do it next month. We got to have that public health and human services budget hearing right before that little formality we go through. So we'll have that for next month. I'll work with Lynn on that. We got the language for last month, the last year.